Hi everyone, this is Dr. Justin here. Welcome to the next episode of Before and Beyond. I'm really happy to be here, and today I'll be talking more about smile makeovers and the process of smile makeovers. And we're gonna talk smile makeovers, and a lot in part would be to do with veneers and crowns. Okay, because that is those are the treatments that we usually do to improve someone's smile. In this episode, I'll be talking more about the process of how we actually design your smile, and what are the things that we actually look out for, and getting all the data that we need to actually go and design the smile. And it's so important because a lot of patients come to us and they say, "Hey, can I see you now?" And straight away, can I do veneers and crowns to make it look good? But I always say, hey, you gotta take one step back, and we need to actually take all the data that we need from you to actually design a blueprint, a smile that you like, before we actually execute the plan. And if we don't do that, and a lot of dentists actually fall to the trap of just doing it without actually thinking about it, that really sets the whole flow in a bad way. And often what happens is that you have to compromise something in order for us to make up for that lack of thought. Okay, so I'm taking this episode with using my own lecture slides that I made for dentists, because I teach as well. And so I thought it would be nice if I actually go through what the planning is all about. And so it's so important, and dentists, the reason why I'm teaching all this is because a lot of dentists don't really understand what are the data that we need to design a smile. So that's why we're teaching it. All right, so here we go. So a little about me. This is for my slide, so I'm gonna just say it out loud. I graduated from Melbourne. I'm the past president of the Aesthetic Dental Society in Singapore. I'm a general dentist. I'm a trainer and a KOL for a number of different companies and dental supply. So I actually give them my opinions on some products. I'm also a clinic and a lab owner as well. Okay, so today's sort of presentation that I'm doing for you guys is about how we actually perform a smile transformation, and the first thing in all modes of medical treatment would be to actually get data first, right? And that's the biggest thing. We want to have data, all right? And if we don't have data, then all modes of data. So if we have enough data, if we do have the enough data, then we have enough options that we can think of options, not just one certain way to do it. All right, it's not a recipe book. Dentistry and medicine is not a recipe book. Everybody is different. Everybody has different concerns. Everybody has different situations. Everybody have different history. It's so important for us to get the data correct, accurately, so that we are able to make the correct diagnosis and a treatment plan. All right. So, like I said, data is to gather accurate and relevant information that will enable the dentist to make informed decisions regarding diagnosis and concerns of a patient, resulting to a creation of a treatment plan. And first, it comes from history taking. So, that's when I see you in a chair, and we usually book an hour or so to really get to know you, know about your concerns, know about your previous history with the dentist, your pain points that we actually need to address. All right, and then we go into a new workflow where we actually take all this data that we need based on the history taking that we have done, and with all this data and all this history that we have taken, we'll then have a discussion with you with a formulated sort of treatment plan already. So the first thing that we do is we actually have an intraoral scanner. So once we have that history taking, we want to take the shape of your teeth. And traditionally, what a lot of dentists were doing last time was to take a mold. So you might have gone to the dentist and to make a mouth guard or to take an impression of your teeth, they take a mold and they put it in the mouth. When they do that, then they have a mold of your teeth and they pour in stone or plaster to have that teeth shape. All right. But now with digital technology, we're able to use a scanner to scan your teeth. So you can see that this is an intraoral scanner. This is called an intraoral scanner. And what the intraoral scanner does is actually, it's like a camera. It's like your iPhone. The iPhone knows the position of where it's scanning or taking a photo of. All right. So when that happens, and it creates a three-dimensional coordinate of all these photos to create that image. So in the end, you end up with a 3D model of someone's teeth, just like this. All right. So you can see that over here we have the upper jaw. Over here we have the upper jaw, and over here we have the lower jaw. Okay. And you might be asking me, what are all these red marks here and the blue marks here and all these yellow marks here and all that stuff? And these are telling me where the patient is biting. All right. The red means that it's stronger there compared to the blue, compared to the yellow, compared to the green, compared to the blue. So I have an indication where the stress points of your teeth. And so if I feel that, hey, if I take a scan and I take the bite and I see that there's a lot of areas that have a very high stress point compared to other areas, either the bite that I took was wrong, or maybe those teeth are under a lot more load. Okay, and because of that, we might want to put like a crown over there in the future before things start to break to protect the tooth. That's a different topic for a different day. But what I'm trying to say is that we can actually look at all these strengths and load of your teeth to perform what we need. Okay, so there's a lot of data that we create. Okay, and then from there we actually to another data collection. We actually have a photo studio in all of our clinics. We have 3 clinics. With all of our clinics, we have a photo studio, and it's a proper setup with lights and cameras. And the cameras are there to make sure that, and the cameras are very, very high res to really, really zoom in to make sure that we see all the details that we need. Okay. Sorry, I got to blank out this patient of ours, but we take photos and it is in a very, very high res. And what that does, it basically sets us up for checking where the midline is, checking where the horizontal plane is, checking where her eyes are, then also checking where her smile curve are. I think we discussed about the smile curve, and whether her one side of her jaw is longer than the other side, where her nose is shifted to the other side or not. All really, really matters in designing a smile. Why? Because if you don't take into consideration the facial features, the facial reference points of your teeth, of your face, then you're gonna design a smile that is not in harmony with the face, and it looks very weird. It looks very awkward. You might have seen of some of your friends that they have done braces or they have done veneers, and they just look straight, but it doesn't look like those teeth belong to them. And often you ask yourself why, because if you take a picture of the teeth alone, they look great, right? But if you take a picture with the face, with the teeth, they look weird, and this is because the teeth are not in harmony with their face, and so we often need to take pictures of their face to decide correctly about it. Okay. All right. So let me just go back. We also sometimes take X-rays of the face, right? Of the mouth, of the jaw, of the skull, and this is needed only in certain cases because we don't want obviously to create more radiation for the patient. And so we take an X-ray because we actually are able to see the bone structures, the teeth structures, just in case we need to plan anything that involves the bone. For instance, implants. For instance, jaw surgery to move the jaw in a specific way to make it in a more aesthetic manner or more functional manner. Okay, so we might take an X-ray. This is a 3D X-ray that allows us to be able to understand the bony morphology of the teeth, of the jaw, and of the teeth. So you can see that this is an example where we take photos, okay, as well as take a video. So we will take a video as well in case to see how the lid moves. All right, so if you have a look over here, we can then see how the lid moves. All right, you can see that when you're smiling, when this person is smiling, she's showing a lot more gums than when she is smiling statically. So you want to see the smile, the natural smile, both in a static and a dynamic way. Therefore, when you're smiling, it looks good. All right, anytime. You don't want it to have like a postured smile, meaning to say that the smile only looks good when someone smiles in a certain way, that selfie stick way, right? You want that smile to be beautiful in all different aspects of motion, right? So that's so important. Of note as well, we also have a face scanner as well. You can see that we also have a face scanner, and the face scanner just takes all that 2D images that we take, the photos we take, and mesh it onto 3D so that we can see contours of the face, and how protrusive something is, how intruded someone is. So what I mean by that is that if maybe the jaw is a lot more back set compared to the upper jaw, we can tell with a face scan. Okay. And so we have all this information. We have the jaw, we have the jaw, which is the bony structure over here, and we have the 3D rendition of the teeth and the gums. All right, and so now the teeth are the same teeth over here. The teeth are in the same teeth over here, right? And so what that means is that we can actually superimpose the data together. Okay? So you can see this is what we do. We can actually have a data set that is the patient's face using the face scanner, patient's jaw, so the patient's jaw over here, jawbone, so the bony outline, the bone itself, and the bone anatomy. And then also we have the intraoral scan. So we have the 3D model of the teeth, you have the jaw, which is the bone, okay, and the teeth as well. And then we have the face scan. So you have the face scan over here. So I literally have a 3D avatar of the face. All right, I can have all the data that I need to really design the smile, and from there I'll be able to then perform my treatment planning and design the smile based on all these features. Okay, if your dentist is looking at only the teeth to fix your smile, then he needs to look more. He needs to look at the face. He needs to look at other things in order for us to design a nice smile. Okay, and that's so important. I keep on emphasizing that, because if you have a look over here, these are some of the reference points that a smile designer needs to use to be able to design a nice smile. So you can see that we are looking at whether it's in line with the eyes, whether it's in line with the joint, okay? And so there are different planes that we use. You can see there's also a vertical plane as well that we use to design the smile. And so if we don't do that, then we don't really have a nice set of teeth. And so this is just one way of designing a smile, which is basically over here, just a very, very quick and easy way of designing a smile that we can actually use reference points for. You can see that from there, I can then look at different types of structures and shapes of teeth that I can put on that will try to blend in with the smile. And so I'll talk more about that in the future. Okay. You can see that I can rotate it in different dimensions to make sure that I get what I need. Okay. All right. And now, once I have all the data that I have, I can then design a smile. And when I do design a smile, it takes time, okay? It takes time between me and my dental technician to sit down and look at features to make sure that it looks natural, right? And so that's what we're gonna do. And how we do it, and once we design the smile already, once we design the smile, it's important for us to test run the whole entire system. What I mean by test run is that we design a smile, we put it on top of your teeth, we let you have a look, we let you try it out before we actually go and execute the whole entire thing. Because once I start to execute the thing, and that might involve shaping your teeth or changing the structure of your teeth, it could be irreversible. There's no going back. There's no going back, and so we want to try to do as many things beforehand that is reversible before we even step into the realm of being irreversible. All right, so that's very important for us. All right, so I think that's all for this episode of veneers on data acquisition. I'm gonna start you off with the next episode soon, where we talk about how we actually design a smile. At the same time, how actually we're gonna do a test run of your smile. Okay, so I'll see you guys really, really soon in the next episode. Thank you.